The patient was a 65-year-old retired man who did many DIY projects at home and kept busy. He had pulled a muscle and had pain on the neck and shoulders, usually on one side at a time. The pain changes side nearly daily. He was angry and frustrated because this was making him sit at home doing nothing. He had the pain for over 2 years, but it only bothered him occasionally. There were weeks when he was free of pain. His muscles were quite small and tense, and he had rather pale, dry, and wrinkly skin. He was a nervous little man with some nervous twitching of the neck. In his words, the pain was much better if he did not do any heavy jobs for one day, but it returned if he worked. True, his tools were quite primitive and not labor-saving, but he was not prepared to buy any. So could I put him right that he could get on his work with his work. Diagnosis, we have the liver blood engine deficiency, wind heat pain. So there is deficient blood gene and excess yang and qi. This was clearly an overuse syndrome and a muscular pain in a large area involving many meridians. So it was better to treat the organ liver for muscles. The pain was changing sides between left and right side or between neck, shoulder, and arm. This is a typical wind character. It was a hot pain as it appeared only during physical work, and it was an intermittent pain with pain-free intervals. Therefore, sabi ng author, I diagnosed it as a recurrent wind heat pain. The patient was quite pale, nervous, and irritable with small and tense muscles. These signs show that there is a blood deficiency and the muscles have less endurance. Prolonged physical work can strain these muscles. When he overstrained the muscles, they get heat and wind, and he gets tired and irritable and does not understand why his body does not comply as it did when he was 40 years old. So treatment, we first advise him on his diet and eating habits. Instead of corn flakes in the morning, a sandwich for lunch, and a cooked dinner, he was advised to eat a cooked breakfast and a substantial lunch so that he had some energy for his work. He was to avoid sour foods and wines for a while. I also suggested a herbal iron syrup. So sa points, electrical stimulation on any severe local pain. GB20, small intestine 12 with wind elimination sedation technique, this being the wind elimination points in this area. Liver 5, blue point, tonifies yin and sedates yang. Kidney 7, tonification point. I use this point to tonify the mother of liver. Spleen 6, the meeting point of the 3 yin of the leg and distal point for lower warmer. This point helps to descend the heat because the heat ascends to the upper warmer. Do 20 as a tranquilizing point. REN 14, UB 15, UB 17 are for blood building. As he could not afford many treatments, sabi ng author, I treat him once weekly for 4 sessions and then fortnightly for another 4 sessions. There was quite a subtle change in him during these 3 months. He became calmer and more tranquil. Not every chore had to be completed yesterday but could wait. He slept better and woke up refreshed. He mentioned that his muscles seemed suppler and he did feel that he was not straining them when working. He had noticed, however, that when he ate tomatoes, his pain could come on. I still see him once or twice in a year when he comes with pains, but he feels better after just 1 treatment session.